Good morning, everybody. This is Amie Regester, the completely unprofessional daughter of Teresa Regester, who has over 35 years in the home health sector, both as an administrator herself and then as a surveyor. So that's my mama. She comes packed in a delightful 5'6" body with long blonde hair. You can't see her because we don't like to put on makeup when we don't have to. So this is an informal podcast with very professional, very intense, helpful tips for you today. So, Mama, I want to start off by asking you just to give a little bit of background on why you're doing this. Why are you doing what you're doing? Who are you trying to reach? And then I'll get into some of the survey prep questions.
Well, so when I started in the home health industry many, many years ago, there really were no mentors that I could contact or anyone that I could really ask questions of without putting myself or our agency in jeopardy. So what I'm doing now is trying to provide information to help especially new administrators and new managers in the home health industry, to give them resources and a place to safely ask questions and to find resources that might help them have better outcomes, not only in their survey, but in their provision of services to our patients.
Yeah, absolutely. Ooh, I just got a little dog growl going on in here. All right. Yes, we're working from home. All right. Well, let's look at, thank you, by the way. We know that those who are tuning in and those who are listening are the kind of people who want to do good in the world. And Teresa is here to back that up. So thank you so much for being that kind of human. For those who are just really, really getting started, they may not even know about who is doing their accreditation. And you have a little bit in a document and you've put some stuff online, but you talk a little bit about why somebody might need to, first of all, know who's doing their survey and know their survey history. Let's say they're not brand new to the game, but they're stepping in as new. Talk a
New
little bit
administrators.
Yeah, talk a little bit about their survey history.
So there are a few things that a new administrator may not know. One of them, well, let me back up. Sometimes you might have a really good clinician that's being promoted into a position of an administrator or director of nursing for an agency. In those situations, it's not likely that that person is going to have much of a background in the survey process. Mm-hmm. They may have been through a survey, but they have not had primary responsibility for making sure that their agency is ready for a survey. They may not know when their last survey was conducted. Mm-hmm. I remember being new in that position, and I did not know when to expect my next survey. So the first thing they need to find out is, when was their last survey conducted and what was the reason for that survey? There's a number of reasons that a survey could be conducted. It might be just time for their routine survey, which occurs at least every 36 months.
Okay. Wow.
Or they may have had a survey for a change of ownership, or there may have been a complaint survey. So first of all, they need to know, when was the last survey done and what was the reason for that survey?
Okay.
If by chance an agency is scheduled for a change of ownership survey, it will normally occur within 2 months of a change of ownership. So at that time, if it's close to the same time as an agency is scheduled for their 36-month survey, then it may happen early. It may happen at 2.5 years or 2 years and 4 months. So there's no absolute time frame, and CMS likes to make sure that surveys are conducted by surprise. So they purposely sometimes change up the schedule to make sure that agencies are surprised that they're not just expecting a survey at a certain time.
Right.
I also
Ooh,
wanted
stressful. It's like
it is.
first thing you
It
do
is
when you
stressful.
take this job. The first thing you do, you get in there, you say yes to that. Yes, I will take this position as home health care administrator. Now, show me when the last survey was conducted. Where can I find all those citations or deficiencies?
Right. And I would want to see the report of deficiencies from the previous survey, so you know what lies ahead as far as your challenge to make any corrections. I was naive to the kind of questions that I needed to ask. So yeah, when was the last survey? What were the findings? What do I need to tackle to make sure that we're not cited for those things again? And
Yes.
what are my resources? How can I know what I'm supposed to be doing?
Right.
You really, a lot of times you're not oriented very well to the position because it's the top position, and whoever's hiring you often doesn't know themselves what you need to know. So you have to know. You
Well,
have
that's a
to
soothing
orient
thought, isn't
yourself. What?
That's a soothing thought, isn't it? Well, we're
Yeah,
hiring you to know it all. So, all right. Well, let's
it's
keep this moving because we have 7, and that equals out to about 2 minutes for each. So
okay.
that's the number 1 is know your survey history. What do you think is the number 2 thing that you want to talk about for prepping?
Okay. Another important thing to understand is that not all regulators are the same. Not all organizations who conduct surveys use exactly the same requirements. So you have to understand who is going to do your survey. Each state has their own laws and regulations for home health agencies. So you need to know your state requirements. If you are being surveyed by an accrediting organization, and there are 3 of them, you need to know what those standards are that you have to meet. And then, of course, you always have to meet the Medicare conditions of participation if you're planning to bill for Medicare services. So you do have to understand the regulators that specifically look at home care. And then you also have to be aware that there are other organizations whose laws and regulations impact the way you conduct business. Some of those would be OSHA, Office of Civil Rights, Centers for Disease Control and Prevention, Immigration and Naturalization Law, Federal Labor Law. So there's other regulations. If you are having an accrediting organization do your survey, they often incorporate many of those other regulations in their standards. So that's one of the benefits of having your agency surveyed by an accrediting organization.
Okay.
So that'd be number 2.
Okay. Just in case I see a couple of people joining and clicking on, if you're just joining us, we do want to let you know that instead of having to scribble notes furiously, this is on the Home Health Mentors Facebook page in writing. So we're doing this because sometimes it's easier to listen to audio and kind of get an overview, but this is available kind of as a tool. So you'll be able to copy and paste these notes. And then at the end, we're going to give you a way that you can get a hold of this in writing and in downloadable form And also there'll be some tools for sale and available for you in the future. So, Teresa, take us to number 3. You talked a little bit about this, you hinted at it, but what's the third way that admins need to prep?
Okay, just real quick, we first covered know your survey history. Secondly is understanding the regulators. And now 3, know the conditions of participation and the standards. So yes, you do really need to go over the conditions of participation with a fine-tooth comb. Sorry, just a second. I'm going to take a drink here.
As opposed to making sure that maybe you've hired somebody as a consultant and your consultant knows all the conditions of participation, but you're saying that it's important for the administrators themselves to really know what's going on. Just a wise thing to do.
Yes, and within the conditions of participation and standards, there are levels, and level 1 is a level of standards that really are the most important things that surveyors look at.
The
So
must-haves.
yes, they're the basics. If you do well during a survey on your level 1 standards, then your survey will be fairly quick and easy, relatively speaking. If you don't do well on level 1, then it progresses to a level 2, and then the surveyor is going to look at additional documents and have additional concerns. So it's important to do really well on the level 1.
It's basically like your mom asking you to clean your room, and then she comes in expecting to see a clean room, but she sees stuff poking out from under the bed. Now she's going to be like, oh man, the surveyor wants to find your level 1 stuff done well and properly. It makes it better and easier for everyone. It lets them know you've heard and understood and made a good effort. Is that a good analogy?
That's a great analogy. So
clean your room, kids.
Yeah. So you'll want to review the 2018 Surveyors Protocol, which you can find on the CMS.gov website. Okay. I think I'm losing my voice a little bit.
Well, I heard that they sell spares on Amazon now.
So yes, there are 14 conditions, and under those 14 conditions are a lot of standards. So you want to make sure that you understand what the level 1 and level 2 standards are, and make sure that you do well on the level 1. And then I would secondarily say make sure you cover level 2 as well in case your survey goes into a level 2. What you want to totally avoid is anything called an immediate jeopardy, and you can research that, and I'll probably cover that at a later date.
Yeah, it sounds like not a fun game show.
It is scary.
All right, take us to number 4.
Okay, so number 4 is know your own policies and procedures. And yes, it's not unusual for surveyors to get into a survey and ask for a copy of the policy and procedure manual and compare what the manual says with what they observe happening in the agency. It is very common, I would say, that agencies are found not following their own policies and procedures, and in fact, not even knowing that they're doing something different than their policies and procedures say. So it's important for administrators to go over the policies and procedures, make sure that your top clinicians look at your clinical policies and procedures to make sure that your staff are actually doing what your policies say. If not, then you need to go through an appropriate process to either review what's being done and change what your staff is doing, or change your policy and procedure if you have the information to, to substantiate a reason for changing it, and then go through the process of having your board approve those changes. It's really important that agencies understand that any changes to policies and procedures need to be documented and archived and approved by the board of directors. They are the ones that have the legal responsibility for making sure that the policies and procedures are followed.
This is so interesting to me as somebody who, is kind of into looking how businesses are run in general. This is really just good business. This is just good business. And in home healthcare, this is good business that affects people's lives. So I see, like, of course, you want to pay most attention to it when people's lives and health are the outcome of this. But, there's so many opportunities here to look at your whole business and say, are we functioning well? Do we have great communication down all kinds of lines, right? So we make a policy because, whatever reason it is, and then we need to make sure that people know about it and that they are trained on it, but that also, if it's not working in the field, in the real world, that they have a way to say, you know what, we get why this policy was made, but we, as the staff, see a better way to do it, and, have administrators open to that if it fits the bill but could be done better. Just having that open door of communication is just great business.
Yes. The other thing to remember is that your policies and procedures don't just affect patients, they affect your staff. So it's really important to make sure your personnel policies are being applied fairly and equally to all staff members. And if you make changes, to make sure that you inform your staff of those changes and give them appropriate opportunities to, give you feedback.
Yeah, that's great. Okay. Let's go on to the 5th prep principle.
So number 5 is to review and update any service contracts that the agency has. Part of the board's go ahead.
What's a service contract?
A service contract could be a contract with a professional person who provides physical therapy, occupational therapy, those kinds of things. Or it could be a contract with a company that, for example, comes in and inspects your fire extinguishers and makes sure that you're following, fire safety regulations.
Okay. So anything not done in-house, billing or anything like that might be a service contract.
Yes. It could be a contract for the legal disposal of any of your shredded documents, which is a biggie, or getting rid of your hazardous waste. So any kind of contract needs to be reviewed at least annually by your organization. And usually it's the administrator's responsibility to provide a list of those contracts to the board, when they were signed, what the current status is. Are you using that contract still, or is it now defunct? If you are not using a contract, you need to give appropriate notice to the organization that you have that you want to terminate the agreement. That's important because if you're ever sued for something, you don't want to be in, or if they are sued for something, you don't want to be associated with an organization that's being sued, because legally they can then include you in a lawsuit. So anytime you are not using a contract or you have a complaint against a contractor, you want to make sure that is in writing, that you give them time to either correct it, or if it's egregious, you just want to terminate the contract for cause. But the board really is the entity that has the legal responsibility to review each contract and to either continue it, which is usually a perpetual kind of thing. But you should document at least annually that the contract has been reviewed.
Okay. I feel like
any
you
contract
put this here for a specific reason. You saw this a lot as a surveyor, or a lot of problems with this, and that's why it made the top 7.
Yes, actually, I've seen a lot of problems. For example, I've seen people without the authority to sign a contract actually signing contracts. In other words, it has to be a board member or someone with the authority to act on the board's behalf to encumber the organization. So that's number one. Number two is whether or not the contract contains all of the things that Medicare requires them to have, especially if it's direct care, a contract with a direct care provider. And then I've seen a lot of contracts that just go on and go on and go on that nobody is using, and it's putting the organization at risk in case someone sues the other person or the other entity that's under contract with you. You just don't want to be associated with them legally because you can be drawn into a lawsuit and you're like, hey, I don't even have anything to do with them anymore. But if an attorney's looking at, who this entity contracts with, they just might pull you in as, another person involved in the lawsuit, and then you have to defend yourself. So just get out of any contracts you're not using and make sure that you review them regularly.
Okay. All right, good business. Okay, what's the 6th?
The 6th one is make sure you're auditing personnel files and that you're applying the job descriptions appropriately. So one of the things that I've seen is agencies often will promote somebody from within, and they fail to orient that person to the new job, have them sign a new job description, change their evaluation date. They just get sloppy about keeping up those personnel files. So there's all the initial things that happen when you hire an employee, and a lot of agencies do pretty well with that. They just fall down on the job when it's time to update personnel files. A big citation has always been the failure to document competency of your staff. Usually when a person is hired, if it's a clinician, the agencies do fairly well at doing an initial competency assessment, but then they fall down on the job when it's time to do their annual competency update. So people don't generally understand the reason that you do an updated competency checklist. You're hopefully seeing that person's clinical skills growing throughout, the time that they're employed by the agency. So when you do the initial competency, you want to know what that person is capable of doing for patients. But throughout that year and the next year and so on, hopefully their skills improve and they become more skilled and can do more treatments or have, the ability to handle new kinds of techniques. So you want to include all of those in your annual competency updates. You also want to make sure that you document when you put a person in a new position that they actually meet the qualifications of that position on the job description. I've seen too many times where someone does a really good job in a certain position, they're promoted to a higher level position, but when you look at the actual job description, there's a mismatch between the person's education or certification or qualifications compared with the job description. So you want to make sure that you don't promote people into a position where the job description requires a certain educational level or certification level, especially if there's someone else in your organization that has those qualifications. You're kind of opening yourself up again for a lawsuit.
Yeah, that's just another great, all around business thing to do as well. So just
Right.
building stronger businesses. And I think that's one of the things that I've noticed from talking with you and learning more and more about home health is that a lot of times the things that are requirements and recommendations, it's really just going into building a great business. As much as it does seem sometimes heavy-handed up front, that's what you want to do anyway.
Right. Well, you have to remember as an administrator or manager for an organization, you do have a higher level of responsibility to protect the organization. At a clinical level, your focus is absolutely focusing on the care of patients. When you become a manager or a supervisor or an administrator, your focus is not, you don't stop focusing on patient care, but in addition, you really have a level of responsibility that is to the organization's survival or its long-term survival and well-being. So you have to look out, you have to be concerned about potential liability and other kinds of risks that you never even knew existed before. In many cases, you didn't know about it.
Right.
So, with all go ahead.
Sorry, go ahead.
I was just going to say, with all the current discussion of equity, equality, suffice it to say, just suffice it to say,
audio.
Can you hear me okay?
I can, but for a minute you dropped out there. So I think I was interrupting you and then you were interrupting me. So go ahead.
Okay. So what I was saying is that with all the current discussion and focus on equity and equality, I will just remind everyone that it's important just to make sure that you apply all personnel policies fairly, equally, without discrimination. And I think most agencies know, to do that. It's just a whole different world sometimes. I could tell some stories, but I won't take time right now to do that. There's some additional information at the Home Health Mentor Facebook page that goes into a little more detail on personnel files, but I'll just leave that for you to go back and read.
Okay. That's what I was trying to interrupt you on. Before we go to number 7, I have a couple of requests saying that they're not actually sure which post this was on. So I'm wondering if you would be able to repost this on the top of the page after this. Okay.
Sure.
All right. That will take care of that. And we just want to thank you before we go on to this final 7th one. Thank you so much for joining us. And if you do have any other questions, of course, you can hit Teresa up. Usually Facebook is the best. We've just started broadcasting to YouTube as well under the same name. So if you have a question or you want to follow up with this, under this chat is fine, under this video. And then you can also send my mama a private message there on Facebook. So, all right. Will you take us to this number 7 prep for admins?
Yes. It's real common for agencies to have certain physicians and maybe physician's assistants, nurse practitioners that they work with that they know really well and they are very familiar with their credentials. But it's good for every agency to have a credentials binder where you have a list of the physicians that have ordered care for your patients, and then to get an actual signed, an actual signature for that professional, whether it's the physician, physician's assistant, or nurse practitioner. Anyone who's going to sign any of the orders that you obtain, you want to make sure that you have a copy of their actual handwritten signature. A lot of agencies, a lot of organizations have gone to electronic signatures, and that's very understandable. But if you ever have hand-signed documents from those individuals, you want to have a way of comparing what you're seeing on those documents with something you know to be an actual handwritten signature. So that surprises people sometimes. They don't have one of those.
Well, why is this a top 7 survey prep thing is what's going through my mind.
Because you are held responsible for following physicians' orders and to be sure that the orders that you are acting on are legal orders. So this could be a huge issue if there's some kind of a mistake in the care that's being provided to patients. It's also important for billing, because if you happen to have a new person that comes along that, and we do know that there are people who have impersonated physicians and other care providers. If you act on orders that are not properly received, not only can it, harm your patient, but you could not get paid for those services. So,
I mean, are there really a bunch of forgers running around? That's what.
Well, I wouldn't say there's a bunch of forgers, but
the one that is running around is
could really.
Wow.
Well, and you want to make sure that when you are submitting a bill, that you know that person had the authority to give you those orders.
That's wild. So are people in the agency really supposed to be comparing signatures then?
I mean, again, it's not something that you do, with physicians that you are real familiar with. And we have a lot of people who in the industry who have marketing people that go to a physician's office, pick up signed orders. They know the physician. They've worked with them for years. They have their, their medical license information and so on. Those are not the people I worry about. I worry about new kinds of people coming into your service area that you're not familiar with. So, and other people that maybe are not physicians, but physician's assistants or nurse practitioners or people that you may be less familiar with. But you are supposed to have a way, and this is a requirement, that you have a way to determine that the person giving you the orders has the authority to do so. And the credentials binder gives you that.
Oh, that's awesome. Yeah, we've all seen those 48-hour specials about those impersonators. That's what you're making me think of. All right. Well, that's about it for today. As we mentioned, this discussion is in written form, so you can have all the notes together. Teresa is going to repost that to the Home Health Mentors Facebook page, which of course is facebook.com/the Home Health Mentor. And just to let you guys know, we do have survey prep materials there for sale. Mom has put a lot of time into developing different tools and making things clear and concise for you. So while they are we're actually working on a new Shopify store. So if we've got your email address, we'll be able to let you know when that's ready and live. But if you need it, if you're in an emergency situation, I'm sure we can work something else out. So please contact my dear mother, Teresa Regester, and let her know if you are in a bad way. But anything else you wanted to say about survey prep before we go, Mama?
I just wanted to tell people our next session, I'm hoping to give people some tools so that they can do their own mock survey.
Okay, that's awesome.
And I don't have anything else.
Okay.
Any other suggestions? People could, feel free to post on my Home Health Mentor page on Facebook if they have other questions or other topics they would like us to cover. It would be helpful to me to know what questions they might have.
And that's the beauty of getting in early on a new movement or a new business, is that your suggestions are worth a lot, and we're not so overwhelmed that we can't consider them. So getting them in, and especially if we have multiples on the same lines, that'll be easy to do. We are going to be trying to do these Q&As regularly. Had some family stuff come up the last couple of weeks, but this is something that we enjoy doing. Is it easy and a cheap way to get information out there? So we want to make sure it's info you're interested in. Let us know. And until next week, that's probably it for us for today. Thank you so much for joining in.
Thank you, and see you next time.
Yeah.